Hi, everyone. Thank you for joining me to talk about nutrition-specific and nutrition-sensitive approaches to improved nutrition. My name is Amy Eibold. I'm acting as a Senior Technical Advisor for Nutrition with the Food and Water Systems team. Specific and sensitive are two words that sound similar, but they're used to describe very different approaches to improving nutrition. Specific interventions address the immediate causes of malnutrition, including stunting and wasting. An example might be micronutrient supplementation. Nutrition-sensitive interventions are not primarily focused on nutrition, but they do address the underlying determinants of nutrition. But what is key, and what we'll talk about during this presentation, is that accelerating global progress in nutrition requires us to couple these approaches. But first, why nutrition? Very few countries were on track to meet the nutritional targets set within the Sustainable Development Goals, and the COVID-19 pandemic is very likely to erase some of the progress we've made. And this is especially true in low and middle income countries. Investing in nutrition is integral to building human capital, and that is essential to achieving the SDGs. And yet in 2020, 149 million children under 5 were estimated to be stunted, while 45 million children were estimated to be wasted. Around 45% of deaths among children under the age of 5 are linked to undernutrition. So addressing and mitigating malnutrition and undernutrition is linked to improved health, to physical and cognitive growth, to intellectual performance, and earning potential. And these investments, made especially in the first 1,000 days of child's life, have lifelong benefits. So a little bit about nutrition-specific interventions. These interventions address malnutrition and they improve nutrition status directly. So examples might include the promotion of exclusive breastfeeding until 6 months, followed by complementary feeding of babies after the age of 6 months. It's distribution of iron and folic acid tablets to women of reproductive age, as well as hand washing and improved hygiene practices. And studies show that these types of interventions have a statistically significant association with a reduction in stunting. However, it's also important to note that it's difficult to scale some of these through direct implementation. And over time, there's been a shift in how we think about addressing malnutrition. The Scaling Up Nutrition movement has recognized that there's really no single organization or government with just a unique mandate to advance nutrition, and that this is a complex issue that really demands multiple contributors and stakeholders to work together for improved nutrition. To increase effectiveness and scale, we have to think about nutrition-specific interventions, as well as innovative partnerships across the public and private sectors. So nutrition-sensitive approaches contribute less to the reduction of malnutrition as compared to those specific interventions, but they play a very important supportive role in the decline of stunting in children, although there is no statistically significant association between these nutrition-sensitive interventions and stunting. Examples of nutrition-sensitive programming can include activities you see here. So those around water and sanitation, improved healthcare, improved agriculture, and women's empowerment, for example, through VSLAs. A great example of opportunities for nutrition-sensitive programming comes through agriculture. So while we might design a project focused on agriculture, we could leverage farmer field schools as an entry point to discuss budgeting or the importance of dietary diversity with women. For example, we might also design activities that are sensitive to the time that a woman might choose to breastfeed her child or the time it might take to prepare complementary foods. The FAO also provides a more in-depth matrix to help identify different entry points to improve nutrition in agriculture-focused projects. This is a lot to look at, but what you see on the left-hand side is types of projects. And then moving toward the right, there's different entry points to improve nutrition through these activities. We'll zoom in here at the value chain development. So considering value chain development, we might consider different entry points like trade and market linkages, marketing and promotion, processing, or storage and transport. So a great example here might be when thinking about the improvement of storage and transport, how can we also be sure that we're improving the health and sanitation overall environment of foods, improving food safety, and that's going to contribute to improved outcomes around nutrition. If we think about trade and market linkages, we can consider value chains and linkages to markets for women, thereby improving women's empowerment alongside their income. And that in turn may give women more decision-making power in the home, may give them more decision-making and purchasing power at the market to purchase more dietary diverse foods. I wanted to share the framework for actions to achieve optimal fetal and child nutrition and development because it does such a nice job of illustrating the different pathways and interlinkages between nutrition-specific interventions, which you see on your left, and nutrition-sensitive programs and approaches on the right in green, which are all underpinned by the enabling environment. And what you'll notice is that these pathways are all very much interconnected and then leading to benefits over the life course. So we know that these initial investments in nutrition are very important. I'll close today's discussion talking a little bit about an example of an integrated nutrition program at CARE. The Collective Impact for Nutrition project operated from 2018 to 2020 in Bangladesh and Benin, but it was also based on a previous project at CARE known as Nutrition at the Center. So Nutrition at the Center operated in Bangladesh, Benin, Ethiopia, and Zambia, and it was a 5-year program that aimed to reduce anemia in women of reproductive age as well as stunting and anemia in children from birth to 35 months. What you'll see here on the slide is some of the positive outcomes of the project. It was quite successful. But one of the big learnings is that if we really want to eradicate stunting, we need to move from direct implementation and toward a convening and coordination of partners for joint implementation of CARE's proven program model. And this model focused on 3 objectives that I'll share with you quickly. The first was, a true integration of maternal, infant, and early childhood nutrition, of water sanitation and hygiene, of food security, and of women's empowerment initiatives. The second, and I'll use the word again, integration, it focused on an integrated intervention model of malnutrition prevention, care, and support. And overall, the project reached 200,000 women, men, and children through almost 5,400 peer groups, and that included mother-to-mother support groups, VSLAs, social analysis and action groups, and adolescent girls groups. So what is key here, and something that I had mentioned earlier, is that when we talk about nutrition-specific interventions, in order to scale, we need to think about leveraging different platforms to reach a wider audience, and also underpinning these more specific actions with broader nutrition sensitive activities. So building off of this success, we have the Nutrition at the Center project. We have the Collective Impact for Nutrition project. And in Bangladesh, the goal was similar. It was to reduce malnutrition or stunting among children under 2 years by addressing the nutritional needs of pregnant, lactating mothers, adolescent girls, and children under the age of 2. What this project did was focus on, again, building the capacity, the platforms, and the partnerships to focus on a nationwide scale up of the model, which the government of Bangladesh did, and it's included in the second National Plan of Action for Nutrition. And I think that this goes back to the direction in which we're moving and leveraging partnerships. And you'll see the strategic partners for this project are immense on the right-hand side of your screen. So key takeaways. To start, nutrition really is the linchpin of human development and well-being, and it's critical to achieving the SDGs. We talked about nutrition-specific activities that directly impact the immediate causes of nutrition, whereas nutrition-sensitive activities seek to address the underlying causes. Nutrition-specific and nutrition-sensitive approaches really need to complement one another, and nutrition-sensitive programming can be used to scale up those specific approaches. We should also look for opportunities in multi-sectoral programming in ways that can include and promote nutrition. You'll also see here resources. If you want to learn more about CARE's nutrition work, I've included a link to our resources on SharePoint. I've also included a link if you'd like to take a closer look at the interpoints for nutrition-sensitive agriculture provided by the FAO. And if you'd like to learn more about the Collective Impact for Nutrition project, again, there's a link that will take you to SharePoint. I appreciate your time so much, and thank you for joining me today.